Hello, my name is Javali Warwick, Program Manager for Nurse Delegation here at Home and Community Services. This training will be talking about assessment. What we'll be assessing for is the setting, the client, the nursing task, and the long-term care worker. Approved home and community settings are adult family homes, assisted living facilities, and in-home clients. Approved Developmental Disability Administration settings are supported living, group training homes, and companion homes. So what will we be assessing for? Primarily, we will be assessing the client. A full head-to-toe assessment will need to be completed within 3 working days of accepting the referral. Also, we will be assessing, is the client's condition stable and predictable? What does stable and predictable mean? The RN determines the client's clinical and behavioral status is non-fluctuating and consistent, that the client does not require frequent nursing presence or evaluation. Clients with terminal conditions and those on sliding scales are considered stable and predictable. Also, we will be assessing the nursing task. There are 4 prohibited nursing tasks under nurse delegation: sterile process or procedures, injectable medications, with the exception of insulin and non-insulin injectables for the treatment of diabetes, also known as synthetic insulin, central line or IV maintenance, and any act that requires nursing judgment. This will be determined by the nurse performing the assessment. We will be assessing the long-term care worker. Does the long-term care worker have the appropriate training and credentials? Are they competent to perform the nursing task? Identify any additional training that's needed. Also, considering language and cultural diversity. And is the long-term care worker willing and able to perform the nursing task? Here are the 3 credentials for nurse delegation: a nursing assistant registered, home care aide certified, or a nursing assistant certified. Nursing assistant registered does not have any requirements for education prior to obtaining their credential. Home care aide certified is required to complete 75 hours of training, and nursing assistant certified is required to complete 85 hours of training. Also, consent for delegation. So in this process, the nurse delegator is required to discuss the nursing process to include the prohibited tasks for nurse delegation with the client or the client's authorized representative. Consent must be obtained upon initial delegation. Verbal consent is acceptable for the first 30 days. However, written consent must be obtained after the first 30 days. A scanned, emailed, or faxed copy is acceptable. Consent is only required on initial delegation and when the client or the client's authorized representative changes. For example, if a client is independent and able to make decisions for themselves and situations change and the client then is required to have an authorized representative, then consent must be obtained again. Otherwise, consent is not required when rescinding or assuming a new client. So in review, in this section, we talked about assessment. We talked about assessing the client, the setting, the long-term care worker, and the nursing task. For any questions related to nurse delegation, please email Home and Community Services at nursedelegation@dshs.wa.gov. Thank you.